let me take a moment to introduce this evening's keynote speaker. This is a theme of collaboration, and Daniel and I had a number of conversations about how to insert various conversations over the course of our time together, both in terms of the sessions and in terms of plenary speakers. And one of the topics that we tried to suss out was this question of the impact of the built environment upon public health, how we as leaders in the design professions and the design education were necessarily involved in both problematizing this and operationalizing solutions. And we could think of no better person to bring into our conversation than Dick Jackson. Dick is a member of the UCLA School of Public Health. He's by training a pediatrician. And his work over the course of his career has focused on the impacts of the built environment on public health, particularly as they pertain to children. But I think, as you'll see from his talk, his scope has broadened. He's particularly interested in the questions of design, of urban design, urban planning, and how we as designers and as educators are effectively part of the public health delivery system. I think that may be the best way to characterize this. I think his talk today will touch on some of his research, and currently he's been working on policy analyses of environmental impacts on health, ranging from toxicology, chemical body burdens, terrorism, sustainability, climate change, urban design, and yes, architecture. I hope you'll join me in welcoming Dr. Dick Jackson.
It's a pleasure to be here, and my theme today is that you, as architects, are health leaders. And I'm going to convey a couple quick messages I've been taught as an academic. One, healthcare is a lot more than medical care. When they talk about healthcare reform, they're really only talking about medical care, and they're really not talking about health very much, because health is a whole lot more than just doctors delivering medicines. The major threats in the 21st century will bring huge costs and other impacts that the medical system in no way can cope with, and lots of other partners will be needed. And the good design is socially cost effective. Now, I played hooky this morning on this magnificent day, and I want to look you in the eye and say to those of you who are veterans, thank you very much. It just is, I played hooky. I went over to Arlington National Cemetery. The vice president laid the wreath on the tomb of the unknown soldier, a 21-gun salute. It was extraordinarily touching, and I had never had that chance before. I worked for 10 years at the Centers for Disease Control as the director of the National Center for Environmental Health, and I spent about a day a week coming up to Washington, D.C., going over to the Hill. I had an office over here on Independence Avenue at HHS, which is not hydrogen sulfide, it's Health and Human Services. We were supposedly the health agency, but as I went down the street, there was Voice of America, there was the Department of Transportation. Well, the Department of Transportation, well, that's a health agency. And Department of Education, well, that's a health agency. They have all kinds of influence on our health. Next one down is the Department of Energy, the Forrestal Building. Tremendous impacts on health. Housing, wow. First need of everybody is, a place to be. Housing is a huge health agency as well. And then at the end of the mall almost is agriculture. We are what we eat. Agriculture policy is health policy, energy policy, transportation policy. So that's been my focus more recently, but then on the other side of the river is the Pentagon, and they certainly affect our health as well. Every one of you, when you teach, show the picture of the Vitruvian Man, and you tell your students that you are about buildings that are strong, useful, and hopefully beautiful. And of course, 1,500 years after Vitruvius, along comes Leonardo, who applies the same golden ratio and says that beauty is also in the human body if it's balanced, the same 1.6 ratio, which of course was used by the Greeks 1,000 years before, 1,000 years AD, with the golden ratio of the top to the bottom. So when I was doing environmental health at CDC, we'd be dealing with air pollutants and water pollutants. And I read this book by a man whose name I cannot pronounce, Clearing in the Distance, about someone who became my hero. Frederick Law Olmsted was the correspondent for the New York Times in the late 1850s, writing about slavery in the South. He traveled around for about 5 years writing about this. He was also, during that time, designing Central Park and a number of other parks as well. And in 1862, President Lincoln asked him to be the head of the Sanitary Commission. When we think about the Civil War, we think about, oh, this awful slaughter that over 100,000 battle deaths for the Union, almost 100,000 for the Confederacy. Look how many people died of disease. It was twice as many deaths from disease as there was from the battles. And so President Lincoln put Frederick Law Olmsted in charge of the Sanitary Commission, and under his leadership and Clara Barton's leadership and others, they halved the death rate of the soldiers, the wounded who were in the Union hospitals. The generals were really PO'd about this because, they thought he was spoiling the soldiers, giving them clean water, clean air, clean food, and safe places to be, but they got better. He had no idea why they were getting better. He just put in place things that made sense from a hygiene and a health standpoint. And every city in the country that has an Olmsted Park is enormously proud of it. Boston with its Emerald Necklace, Oakland with the cemetery there, many other universities, parks, and the mall in Washington, D.C. with his sons doing the design for that. Frederick Law Olmsted did not understand that social well-being was separate from personal well-being. He did not understand that physical health was separate from mental health. It was all whole cloth. And what we did in the 20th century was we began to isolate, atomize, fragment all of our learning systems. And one of my big themes today is the students of the 21st century want to learn 19th century health and architecture. They don't want to learn 20th century reductionism. Now, I'm a pediatrician, and every time a child comes in to see the pediatrician, they map out the child's height and weight. And hopefully, if the child's 70th percentile for height, they're 70th percentile for weight at that particular age. This is what we often see nowadays. Child comes in, he's 50th percentile for height, would be about a 6th grader at this point, but he's 95th percentile for weight. His blood pressure is too high, his blood sugar is too high, he's not diabetic yet, he's not spilling sugar into his urine, his cholesterol is too high, and not surprisingly, he's showing signs of depression. And when I say to the pediatricians, have you seen anyone like this today? They say, yes, I've seen about 5 of these today. And the same is true for adult medicine, too. Now, a good doctor would not immediately put the child on medicine. Dad, no sodas in the house, no more screen time, get the TV out of the bedroom. Child's got to be out doing physical activity, and you got to control what the child eats. We want him on a better diet. Change what he's eating in school, and he needs to be doing more exercise. Change what they're doing at the PE program, because he says he's only standing over at this side while all the kids that are good are doing all the exercises and everything else. 2 months later, he comes back to the doctor, and what's the doctor? Fine. Nothing has changed. And this happens over and over again. He can't change the food. His day is already too full. There's no time to exercise. He's not good at sports, and it doesn't do any good to tell me to walk because there is no place to walk. 2 months after that, he's taking 4 different drugs, something for his blood sugar, something for his cholesterol, something for his depression, something for his high blood sugar, at a cost of about $400 a month. So in essence, what we have done is we have medicalized the diseases that are driven by how we have created modern American society. Do you think this costs a lot of money? Look what's happened to our healthcare costs. When I was a young pediatrician, we ran a program. We brought in all these bright people to talk about the skyrocketing cost of medical care. 7% of all the money in the United States. Today it's 17%, and there are serious people that think it will be close to 25% by the year 2030 if this continues to go forward. I can go through the reasons later on if you're interested. Think of all the money in the United States and this much of it going to this. So when I was at CDC, the head of CDC invited his center directors in to help him write an article for the Journal of the American Medical Association on the big threats of the 20th century. So I'm driving over to headquarters and I'm thinking, wow, the big threats are global warming, endocrine disrupting chemicals, feminization of many animal species, and it's beginning to happen in humans, body burdens of this, that, and the other thing. The injury guy's thinking about the fact that more lives are lost because of injuries than anything else. That's the most important thing. The chronic disease guy is thinking the most important thing is diabetes and asthma and all the rest. Each one of us think we've got the most important disease of the 21st century. So as I'm driving down Buford Highway in Atlanta, Georgia, I look over to the right side and thinking all these grand thoughts, and I see on the right side of the road an elderly woman struggling, walking along. She's in her 70s, bent over with osteoporosis. It's 90 degrees outside. She's got a plastic shopping bag, one in each hand. And I want to stop and give her a ride because she looks so sick actually out there. I don't do it. I'm late for my meeting. I go to the meeting and all I can think about is this woman. I think if she collapses, the cause of death will be heat stroke, and it won't be absence of trees, heat island effects, poor air quality, poor public transportation. And if she's killed by a truck going by, the cause of death will be motor vehicle trauma, and it won't be absence of sidewalks, absence of public transportation, poor urban planning, failed political leadership. So what public health is about is the causes of death. When I was asked by people looking, in fact, Harrison, who gave the talk, he heads a group that reviews all of our curriculum, and we are asked, what do you really want to convey? And what I say is, what I want to convey to my students is what you're looking at is the product of things 1, 2, and 3 steps back, and they need to incorporate how this is all the node of pulling things together. At that, we picked the 10 biggest diseases. The article was in the front page of JAMA in the beginning of the new millennium. These are 5 of them, just what you would predict: overweight, mental health, developmental diseases, injuries, aging diseases, and big environment issues. We have built between 2 and 3.5 million of these every single year during, from about 1994 to about 2006 or so. What's the message of this building? This is a question I ask my students. What does this building tell you? The car is the most important thing in my life. My body, my family is an appendage to the vehicles we have in that box next to our house. In order to meet the needs of our cars, we have removed 60,000 square miles of photosynthesis. Impervious surfaces have been put in their place that don't produce oxygen, don't remove CO2, don't let moisture percolate into the ground and replenish our streams and rivers. It's, by the way, the same area as the state of Georgia. And it's an important number for solar questions as well. Huge loss of farmland. Leading agricultural county in the United States was Los Angeles in 1945. You know that that's been turned to a past crop of simply buildings absolutely everywhere. Now, this has been driving a whole string of outcomes. And this is rising sea levels and alternative theory. This is obesity in the United States in 1986. CDC calls up 200,000 people a year using state programs, ask people their height and weight. This is North Carolina is at about 10 to 14% of the population obese. Here's 1991. Louisiana, 15 to 19% of the population obese. 1994, much more of the country obese. 1997, brand new colors. The yellow means over 20% of the population is obese. The year 2000. The year 2004, another brand new color. Over 25% of the population in Texas obese. 2005, another brand new color, over 30% of the people in Louisiana, for example, obese. 2007, 2008, it just continues, 2009. Average 11-year-old boys gained 11 pounds. The average 14-year-old girls gained 14 pounds. Average American adult more than 25 pounds. What I've just shown you is not true, by the way. When they actually go back and check people that they asked on the phone, and they ask them in person, the men are shorter and the women are fatter. And when you actually weigh them, they're even shorter and even fatter than they said on the phone. So what I've just showed you is what people tell you they weigh. The real truth is it's much worse. This is a study done at Harvard to document those differences. If an enemy of this country had arrived, and we mobilized our military, and the enemy was very sneaky, and they said, well, no state's more than 15% obese. We'll render America unfit for combat. They would do this. They would go to a point that all 50 states, that only one state had less than 20% of its population obese, and 6 states over 30%. 2 out of every 7 volunteers for the US military are rejected for causes of obesity and lack of fitness at this point in the United States. And I'm going to argue that there are built environment drivers for this. We've tripled obesity in our teenagers, and we've quadrupled it in our preteens. And if you're an overweight kid, you're 90% likely to be an overweight or obese adult. It has completely changed the structure of many of our community purchases, for example. If you volunteer to become an EMS worker now, you have to be able to lift and jerk 150 pounds, which knocks out a lot of women and young men, for that matter, to be EMS workers because of the weight of the population. These new ambulances, these E350s, are about 3 times as expensive as the old E150 ambulances because of the weight they have to carry. Of all the articles I've ever written or published, this one has been the most cited. I'm a little embarrassed by it. I thought one day, gee, I wonder about the fact that between 1990 and 2000, every single person in America, or at least adult, had gained 10 pounds. That would work out, if you multiply it times all the 515 billion passenger miles flown, that we had spent 350 million gallons more of jet fuel, $1.5 billion worth of jet fuel, just to haul our additional adiposity around the American landscape. It's the only study I ever did that was cited by Jay Leno, who said, now I know why they don't feed us on airplanes anymore. But Danny Frieden pointed out that, in fact, within this, there's some real truth, that we don't really calculate the real costs of a lot of things that we are doing in our society. I gave this talk in Columbia a year or 2 ago, and my nieces came from New Jersey, and they were sitting there. I listened, and at the end, we went out to dinner, and I said, well, what'd you think? And they said, one of the girls said, I think kids are really bad today. This is awful. And I felt mortified that I would be conveying a message that the children are the problem. The children are simply the product of the environment that we have created that are driving them to this. 40,000 ads a year. A child that's watching TV on a Saturday morning can see between 400 and 500 advertisements, and about 80% of them relate to food, and none of them relate to healthy food, I guarantee you. This is what we were told to eat when we were kids. You know, we got 1 hour of nutrition a year. It's changed since then, but that was what we were told to eat. Fats, oils, and sweets, a little tiny bit, all this other stuff a lot. And that's what kids are told all day long when they watch television. So blaming the child for simply being a product of the environment, this is the nutritional environment we've created, and I'll get to the physical one. This doesn't relate strictly, but it's just an infuriation for me as a pediatrician that more than half of all the foods that are sold to kids that have the word fruit or nuts or something else on it have never seen anything. It's just a red dye, yellow dye, green dye, or something else. And all kids know that if you tell lies, your nose should grow. So I think Kellogg and the rest of them ought to have growing noses. If your little niece put more than 2 teaspoons of sugar into into an iced tea or a lemonade, you tell her to stop, and after 3, you'd really become more insistent about stopping. And yet, no one thinks anything about a child drinking 2 or 3 of these 20-ounce sodas. One 20-ounce soda, 17 teaspoons of sugar, 250 calories. You can burn it off. If you're really a good athlete, you can play basketball for 40 minutes for that one soda. No one can keep up. In fact, the fastest growing liver disorder in America is NASH, which I didn't even hear of when I was a young pediatrician. It's non-alcoholic steatohepatitis. What it is fatty liver. It's pre-cirrhosis, because too much fructose in the diet causes early cirrhosis of the liver. And we're seeing increasing rates of this in our children. In 1969, you did not consume 1 teaspoon of high fructose corn sugar all year long. The shelf disappearance in America now is 63 pounds per person. This is because price supports were changed. This stuff became extraordinarily cheap. It's 10 to 20 times cheaper than cane sugar. It was very cheap to put. In fact, probably the contents of a Coca-Cola are cheaper now than the soda can that they go into. I was in a meeting with Governor Schwartz. I was state health officer, and I made obesity my second priority. And I was in a meeting with Governor Schwarzenegger and about 14 other corporate leaders, and one of the soda companies said, well, gee, if people just exercise enough, they can burn it off. So I got the BlackBerry out, and I sent a note and said, oh, they can burn it off, you're right. 63 pounds is 115,000 calories. You can burn it off, and Governor, we need to equip every single office in the state with an exercycle so you can pedal 318 hours a year to burn off your allocation of corn sugar. Where am I going with this? That it was absolutely inevitable. We were going to be obese no matter what. We create foods that are essentially derived from the commodities programs of the United States government. That's almost a day's worth of calories. It tastes good. It's a short-term bargain. And we put lots of these. This is the built environment part. If you're poor in America, it's much easier for you to buy poor quality, high calorie food because there are many more of these in your neighborhoods than if you live in Beverly Hills or a more favored economic neighborhood. And we know with liquor stores, if you reduce liquor stores, crime goes down in a neighborhood. The same is true. If you look at density of fast food restaurants near schools, you'll find that they cluster around schools as well. So when you finish this, when you go back, I got to give you some practical information. Next time you go to the fast food place and your little child or grandchild says to you, oh, they want me to fast food it, and Grandpa, it's a bargain. If we just pay 67 cents more, we get 73% more calories. Yippee! Well, every time you buy a fast food meal, a supersized meal, you get 73% more calories, a full ounce of adipose tissue, a full ounce of fat. Men put it here, women put it here, but it's still a full ounce of fat, and fat's expensive from a long-term standpoint. It's about $6 for a man and about $3 for a woman, additional health care costs. I make this as a joke, but the larger message here is if we actually calculated out the long-term costs, they'd be much more substantial. We know as obesity goes up, diabetes goes up. You knew these maps were coming. Here's 1994. Virginia's at about 6% of its population being diabetic. 2001 and 2007, so about 9% in Georgia. We're now spending 2% of the entire GDP of the United States on diabetes. When I was a young pediatrician, we never saw a child with type 2. We called it adult onset diabetes. It's now half the kids in the diabetes clinic. And these kids are showing diseases of old age by the time they're into their 20s and early 30s. And serious diseases of old age, including loss of kidneys, loss of vision, and gangrene of the feet. I'm going to skip this one. The only technical slide in the thing, but it's really worth going through for 1 minute. This is what we call overweight. I'm overweight, I'm embarrassed to say, so I'm 4 times as likely of becoming diabetic because as a man, I'd be 16 times as likely to become diabetic as a woman. If I was early obese, I'd be almost 12 times as likely to be diabetic. If I were a woman, 40 times as high. If I'm morbidly obese, I qualify now for stomach stapling surgery. I'm 42 times more likely to be diabetic, 93 times more likely if I were a woman. So these increase in healthcare costs don't even take into account this avalanche of these chronic diseases we're looking at. And this is the slide that got Governor Schwarzenegger's attention most. 1 in 3 of the population born in 2000 will be diabetic in their lifetime. Average reduction in lifespan of 15 years, average reduction in the quality of life, 20 years. So there's also this is sort of bad news, good news. This is a study done out of Harvard, by the way, of 200,000 nurses. They were checked up every year from about early 1970s going forward. The nurses who stayed thin and fit had a standardized death rate. The nurses who became obese had 90% increase in their death rate. But this is the important part for you as architects. Those who became inactive, didn't exercise at all, even incidental exercise, 60% increase, and if they became obese and inactive, 2.5 times the risk of dying. This is all-cause mortality of people in middle and late middle age. So by building places like this that make it impossible for a child living here to get to a house over here without going over the fence and past the Doberman and the Rottweiler and the pervert and the guy with the gun and going all the way over, so every 8-year-old needs to get mom to haul them absolutely everywhere. So every woman in this room drives twice as much as her mother did, who drives twice as much as her mother did, et cetera, and your daughters may well if we continue to build America the way we have. This is a study my co-author Larry Frank did in Atlanta where they actually put accelerometers on people. The more time you spend in the car, the more likely you are to be obese. I know scientists had to do this. Your mother knew this was true all along, but the more you walk, the less likely you are to be obese. And if you build neighborhoods with good connectivity and destinations, there's lower rates of obesity. It's about a 6-pound difference between sprawling areas and George, New York City. If everybody lost 6 pounds, that's a real contribution. Now, you've all seen these stencils. Well, I'm thinking that we should adopt a new stencil campaign. We'll call it the ACSA. And we should put this on every street corner in America, don't you think? You could put your logo below it. So, we build this is the California state flower, and we build these. 405 doesn't work, this awful highway that goes past UCLA, and so to fix it, they're adding 2 more lanes, and it's going to be closed down like most of the time. Everybody shows up for work late every single day because there's some problem here, and we continue to build with lower and lower density, which of course means you drive more and more, and we now have more cars in the country than we have drivers, and only 66% of our population are drivers, which means 33% are really in tough shape. Talk about a discriminated group. If you can't drive, you're really in a difficult situation in America. Well, Northwest Atlanta didn't want the MARTA. I actually had people say MARTA stands for Moving African Americans Rapidly Through Atlanta. And these were black and white people that said this. But I know why the people in Newt Gingrich's district didn't want the MARTA, because they didn't want folks from there coming into their part of the town. So this is 23 lanes and it's stopped still. But they still don't want mass transit going up to Cherokee County where you're required to own a gun. This is in the laws up there. So when I did environmental health, I worried about 1 in a million risks. Do you know what your 1 in a million risk of dying if you're driving in America is? It's about 75 miles. Every time you drive 75 miles, you have bought a 1 in a million fatality risk. There are people in America that are buying 2 and 3 lottery tickets for death every single day. So we have people not living in New York because we're not building on old Superfund sites because we're worried about 1 in a million lifetime risks, and they're buying 2 and 3 lottery tickets a day of death risks. And if you ask the average American who's more likely to die in a pool of blood, and somebody living in downtown Oakland or somebody living out in the hills in the suburbs 50 miles away, they'd always say the person living in Oakland, and they're always wrong because it is such a common cause of death. These are the differences in death rates in cities that are sprawled out versus cities that are dense. Kind of what you'd expect. The same is true, by the way, for pedestrian death rates. So I thought, gee, if the whole country had the same fatality rate, George, as New York City, we'd save 24,000 lives a year. If the whole country had the fatality rate of Portland, we'd save 15,000 lives a year. And if the whole country had the fatality rate of Atlanta, I'm sorry, we'd kill 15,000 more people a year. Really does make a difference what you build in terms of survival in our society. It makes a difference in how hot it gets. And Frederick Olmsted talked about parks being the lungs of the city. He didn't even have the NASA overflight data that proved that if you remove trees, places got hotter. And if it gets hotter, air quality declines for a number of reasons, one of which is the precursors of ozone and all the rest increase dramatically. But what else happens? The power plants run like crazy. So it is a double whammy. And when is the air pollution the worst? And the air pollution is being driven by our cars. It's exactly when we tell our kids to go out, play, and exercise. The most rapidly increasing chronic disease in children in America today is asthma, and to an extent, it is a built environment disease, partly driven by the buildings we build and partly driven by how much air pollution we put in the air with driving. This is a study of 6 high air pollution schools in LA, 6 low air pollution schools in LA. They looked at a couple thousand, 3,500 kids that went to each of these schools and then looked at them at the end of 5 years. These were kids that you'd be proud of. They were doing 3 different sports. They were running, they were breathing hard in the afternoon. And the asthma rate in the kids in the high air pollution areas was over 3 times higher at the end of 5 years as the kids from the low air pollution. What you build, how you build it, and where people are exercising makes a difference. In fact, what do you think? More people die in America from the air pollution from cars or from car crashes? And you know, by the way I asked this, what the answer is. It's actually the higher, we have more mortality from air pollution from cars than we do even from car crashes. Skip these. So really one way to reduce all this air pollution would be to drive less and have, this basically says with compact development you get less air pollution and less ozone. And we ought to be bicycling more because that's one way to reduce our pollution. Well, this is Northern Europe. They do 40% of their short trips walked and biked. And we do 7% of our trips walked and biked. And it's not because we really love our cars that much. It's unsafe most places to walk or bike. I was thinking of renting one of these bikes over here at the end. I was really kind of scared to get on these streets here, I have to admit it, and I didn't have a helmet with me. So we all think this is part of the American Never Walk campaign, and I want ACSA to commit itself to stop the American Never Walk campaign. It was written by Howie Frumpkin, who's now at Seattle, working with Dan. He's the dean of the School of Public Health there. He says, don't build sidewalks. There's Buford Highway. Build sidewalks that are really not where anybody'd want to. That's a lot of paving for very few cars. Let the sidewalks disintegrate. How'd you like to take a wheelchair on that sidewalk as you tip into the roadway? Since when are pedestrians always have to be second-class citizens? It's maddening. Here's my favorite. Multiple strategies. Another one. Never place an interesting or useful destination within walking distance of where anybody lives. This looks like a liver biopsy to me. Or a recipe for teenage depression. Just say it. No pedestrians. This is Hawaii. Make everything car accessible, everything. Pharmacies, dry cleaners, liquor stores, baked goods, flowers, car service, fine food, coffee. This is my favorite. Drive up banking. with braille buttons for blind drivers. Mailboxes. Only in Las Vegas do you have drive-through weddings. If the marriage doesn't work out, in Birmingham they have child support payments that are drive-through. And of course, sooner or later we always go the final common pathway. In Tallahassee they have our drive-through funeral homes. We really have, the car really does own us. I'm running too long here, but one big takeaway of this whole thing is we knew how to build schools that were iconic, that they were destinations that kids could walk or bike to easily. We have given them up for these big box schools that you'd think Costco or the Reformatory had built. And they're really, my boys went to North Springs High School in Georgia. There wasn't a sidewalk within 5 miles. If the kids didn't get on the 3 o'clock bus, so they had to be picked up. And it was a multiracial school. If you only went to class, you never made a friend of another race because they didn't mix in the classrooms very much. In the after-school activities, they would mix. And so my wife and I every day had to decide who was going to, how we were going to pick up the 3 boys at these places. We've made bigger and bigger schools. There's no evidence, by the way, that children learn better in bigger schools. And look what's happened to walking to school. How many of you walked to school as a kid? How many of you have children or grandchildren that walk to school? That's good, Boston. You're lucky. But, taking away the legs that God gave them is not a good thing for their health. I don't believe that we should put the body mass index on the report card, but we should definitely put the physical activity, the fitness gram on the report card. It's 6 measures of fitness, including can you run, walk a 12-minute mile. 3/4 of the kids in my state, and we're probably typical of the rest of the country, cannot pass the fitness gram. 3/4 of the kids can't even do a 12-minute mile run walking. This is after talking about how important it is to be fit. I'm sorry, I put too many slides in, so I'm going to skip climate change and I have to get to the happy part here. So when I was a kid, I swear doctors were advertising camels. When I was a young doctor, the most overwhelming thing, it felt like the tobacco epidemic was completely overwhelming. We were not going to be able to do anything about it, just the way it feels about the epidemics I'm just talking about. And waving our fingers at people and saying, you're too fat, you smoke too much, you do this, it doesn't work. We have to change environment if we're going to change people's behaviors. California's been spectacularly successful, and I will say so. We've gone from 128 packs per person to 44 packs per person just over the course of 15 years. Dramatic increase. The biggest thing, the taxes were important, but the anti-tobacco programs were extremely important. And the most effective anti-tobacco ad was the executives all sitting around laughing about how many kids they needed to addict that day. It was much more effective than stuff they're even talking about the rotted teeth on the box of the cigarettes and all the rest. Cancer takes a long time to prevent. Do you think cancer went down? Look at the difference now between California and the rest of the country. It's dramatic. Tens of thousands of lives are being saved by these social and the other big one was not letting people smoke indoors, because that was a huge social pressure as well. One piece of bad news was they began to change the air changes in a room, because if you didn't have smokers, you didn't have to change the air as often. I'm not sure I think that's such a great idea. I'll skip this. So where do we go from here? We've got to reverse the diseases of the 21st century. The most prevalent disease in America and worldwide is depression. What are the treatments for depression? The SSRIs work very well. Look at happiness in America. It does not track with income. We get happier when we get enough to eat, and we're not sick, but if you really want to improve happiness in America, there are other things you have to do. The things that make us happy are being with people who we care about. So when you build places that enhance and encourage human contact, you are adding to human happiness. And when you build places that isolate people, you are undermining it. Exercise in healthy places. The more people can walk, the healthier they are. Exercise works as well as any SSRI in reversing depression. with far fewer side effects. Actually improves the libido rather than erodes it. And creating places of the heart, which you do as well. What makes people safer? Slowing down the traffic. I'm on a group called America Walks, and we're trying to start a campaign called 20 is Plenty, with a goal of slowing down traffic in urban areas. Putting second floor eyes on the street from the second and third floor reduces crime at about 50%. This is a drawing from Oakland. And putting in transit and biking, sorry about this. Transit and biking reduces CO2 loading of the atmosphere. Leadership really matters. Mayor Bloomberg is behind. I think, George, now they've put in 300 miles of bikeways over the last 2.5 years. It's just spectacular. I haven't been in the city to see how much the adoption is, but if I want to bike, I'd rather bike on something like this than something like that. People believe that biking is dangerous, so I want to just give one little fact. The more bikes on the road, the dramatic decrease in the rate of per bicyclist deaths. Maybe the absolute number goes up slightly, but the per bicyclist death rate drops. So here's some, I'm just going to give you some quick websites. Here's a new one called Abago, Transportation Costs Made Transparent. These are, it's my old house in Lafayette, California. It would have been $1,000 a month. Here's my house that I had in Sacramento. It was $560 a month. Nice and green compared. Density really matters in terms of cost to me and cost to the planet. Skip these. So what are the things that make people healthier? Being mindful about food. This is Walt Willett's study, again from Harvard. I think it's one of the best nutrition books around. He was one of the people that did the nurses study. He's worked with the CIA to change the American diet in the belief that we need to move away from the Northern European farmer diet with lots of starches and gravies and everything else towards a Southeast Asian diet. They train 10,000 chefs a year. This is when I was the governor's Secret Service man, and it was an event that we did on the West Steps in Sacramento in the Capitol around price supports. We provide $14 billion in price supports for things that we don't need, and we provide absolutely no price supports for the fruits, vegetables, and the things that we do need in our diet. And talking about you have to move 2 and 3 steps upstream, this is one that you have to do. We also have to convince every child in America that if you eat food spelled backwards, you're a doofus. And as we age, the best exercise is walking, and so anything we do to remove walking or the ability to walk from our society is undermining our health. I talked a lot about diabetes. The only intervention that we can prove works really well with the fewest side effects is increasing the amount that people exercise. A simple study of a half hour a day, 6 months of walking a half hour a day, and the risk of becoming diabetic and pre-diabetics went down by 50, 60%. Everybody in America, when they go out to buy now, knows about WalkScore. I want to thank Google and whoever else is behind this because it's really great. One of the reasons I'm so passionate about this is the house I lived in Atlanta. It had a WalkScore of 0. This was, we bought this, I hate to say this, we bought this house because we opened the magazine and the best public schools in Georgia were in this district, and we just bought in that district. Didn't realize there were no sidewalks. This is where I lived in Ann Arbor, a WalkScore of 49. So I'm almost done. Charlotte, North Carolina opened a light rail in 2007. It just so happened they were doing a study of health before the light rail system was put in place and after the light rail system was put in place. And they interviewed people at 840 locations before the light rail went in. And they found an amazing thing. People that took the light rail were happier. And they not only were happier, they reduced their body mass substantially. And in fact, if you were 81% more likely of meeting the Surgeon General's requirements or recommendations for exercise if you had light rail in your neighborhood versus commuting. So what's the big theme here? Incidental exercise is just as good as going to the gym, and things that we can do to build incidental exercise into people's lives really do matter. I want to commend New York. I think their active city design guidelines are just phenomenal. I think this will be as important as the grid pattern that was laid out in New York and some of the other major interventions. Every city in America ought to have these guidelines, and any building we do going forward ought to be done in this way. I think every architect that builds a building should not do what they've done in this place, which is you got to search and search and search to find a stairway to go up, and when you get on it, sometimes you get locked out as you go up. This is Tom Penny's office. Kaiser Permanente is running a campaign to get people to take the stairs more. They just didn't talk to their safety people before they did it. But it's a good campaign. And I'm really proud of this. And if you want a handout to read, this was a lot of work. We got the Academy of Pediatrics to issue a guidance statement on what kind of neighborhoods kids ought to grow up in. And the statement was, children ought to grow up in a neighborhood where they get increasing levels of autonomy and ability to manage the world they're in and navigate around. We create neighborhoods now that kids are essentially kept in a box in the morning, kept in a box at school, kept in a box when they get home. And when they're 16 years, they got to be taken everywhere. And when the day they turn 17, they're handed the cars and told, now be responsible. It's a totally absurd system. These are California slides, I apologize. Kids that walk and bike to school learn better, behave better, and socialize better. Every school in America ought to have a garden. Lincoln, California has an organic garden that's run by the middle school and high school kids. They supply all the food year-round for all the kids in that school district. This is pretty wild. I think that Colorado's finding if they have the kids go out for recess before lunch, they actually eat better and more sensibly and behave better than if you hold outdoor recess hostage till they finish eating. Every town needs to have community gardens. I'm working on a PBS special, and we've shot in about 8 different cities. Detroit was heartbreaking because it looks like it's about 70% destroyed or vacant land at this point. And it's going to have to move towards urban agriculture again. You can't find decent fruits and vegetables in a place with magnificent farmland, and it's got to become utilized in some ways over time. When I was health officer, I argued that every community needs to have a farmer's market. I was told this is just for yuppies. If you're poor, this is almost the only place you can buy fruits and vegetables. You know, there's Twinkies and beer at the local store, but there's nothing much else. Mayor Blumberg has worked very hard in having a park within walking distance of everybody in New York. I don't know where this stands right now. It was going very well a year ago, and it does create healthier environments. We in public health want to embrace the design and build world. This is the number of sessions at the American Public Health Association that dealt with land use in 2002. This is the number of sessions in 2003, none. Number of sessions in 2005, 55, 2008, 82, 2009, 130. When I was at Berkeley, I worked to start a joint MUP, urban planning and public health degree. It was kind of silly for the students to have to do 2 years in public health and 2 years in urban planning when there were basically a bunch of common courses, biostat or GIS or whatever, that really could be done totally in 3 years. We're working to do the same thing at UCLA. Brian Taylor, who's chair of urban planning, when we were defending this joint program, made a fascinating statement. He said, we are losing the best and brightest students because we're not offering a joint program, because our students do not want to go into the stovepiped, narrow program. They're much more interested in integrated programs and how things connect across the disciplines rather than solo within the disciplines. I'm sorry. This is a very quick one, and all I was going to say is it's just a disgrace that we don't have high-speed rail in the United States. The Chinese are way ahead of us. The Japanese have run their 5 billionth passenger at over 200 miles an hour back and forth to various cities, and we can't you ought to be able to get back up to Boston in under 3.5 hours, irrespective of the weather. And the fact that we haven't done this with our prowess, either economically or technologically, is a disgrace. It really is. So I apologize. I'm going to skip these, but it's a huge problem. We're pushing very hard to get the subway put into LA, but just as we ought to have every school walkable and bikeable, every university in America ought to be walkable and bikeable. There ought to be safe routes to universities as well. 10 years from now, your kids will not believe that we're using drinking water to water plants. They won't believe that we had roofs that didn't capture sunlight. These are photovoltaics that have gone in Los Angeles. What's wrong with this picture? By the way, there are a couple things right. The fact that 6% of the roof is skylights makes perfect sense. It's nonsense to be using fossil fuels when God's sending sunlight to the roof and we're not using it. It takes a lot of labor, a lot of trucking, a lot of crane work to cover this roof. Why have they only covered the roof this much? Because they've supplied all the electricity they need with that much photovoltaic. And so one of the big things we've got to do is put in place feed-in tariffs so that when they generate the electricity, they can turn the meter backwards. And then there are all kinds of incentives for them to go ahead. And we should have no warehouse roof in America without it being covered with photovoltaics. Just a very quick one for those of you who are builders. And if I had stock, I would buy stock in a company that made very high efficiency air exchangers, because the reason we all hated buttoned up houses was the air quality was terrible. And you know very well that we've got to change air all the time. Radon, VOCs, et cetera, humidity. This is just a picture of a passive house totally sealed, but the high efficiency heat exchangers are extremely important if you're going to do that. I put a thing on the chairs here. This is a PBS special that I've been working on for quite a while. It is completed. We sent it to PBS. It will be 2 hours. They wanted some changes in it. It will come out, I think, in May or so. The original funding came from the American Institute of Architects, and I want to publicly recognize their leadership. And if you want to go to the website and look it up, you can. Our student begins to walk to school or bicycle 1 mile 4 days a week. The family car runs 1,280 less miles, saves 64 gallons of gasoline, saves $704. He makes new friends doing it. He's learning better at school. The 30-minute walk burns 125 calories each way. He burns 40,000 calories each year. 11.5 pounds of body fat. At the end of 2 years, he goes back to the doctor. He's grown 4 inches. His weight's now down to the 65th percentile. His blood pressure is normal. His cholesterol is normal. His blood sugar is normal. His energy level and mood is good. He's smiling all the time. He's got a girlfriend, and he lives happily ever after because he's taken up these efforts. Thank you very much.
One of the great possibilities and potentials of a merging or a partnership between design and public health is that your field has data that gives us the kind of ammunition to make the sorts of arguments that we've been making for years with just anecdotal evidence. So are there sites that you can suggest for us where a lot of the data that was behind a lot of the graphs you showed is available for us to start making these arguments?
This is hard and it's easy. A lot of this data sits on government websites. The good news is that we collect all kinds of data on health. The bad news, it tends not to be coned down to your particular geographic area that you're used to. I think one positive is that if we had students that were trained in both worlds, it could take a couple days of digging within the health world to find this. We are now, in California, every single county health department has a nurse that goes to the planning commission meetings and says, how's a child supposed to get over there? How's somebody in a wheelchair supposed to get over here? How's an elderly person going to have any friends when he loses his driver's license? And at first, the planning commissioners, who tend to be overweight white guys in California, would go, there, dearie, you don't know anything about planning. And what's happened over the last year or two is they're beginning to talk like public healthers, because a lot of this stuff is common sense. And once you begin to think about it, and you think, Other big takeaway, you know, we do environmental impact assessments for all these big governmental things that we do. We do no health impact assessment. We spend more time thinking about lizards than we do about kids. And I think this is a big movement that is coming down the pike very quickly. I'm chairing an Academy of Sciences committee on health impact assessment. I'm not allowed to say what the conclusions will be, but you can guess after this talk what one of the conclusions are going to be. But Tom, I think the core is this next generation is really tuned into ways of bringing both worlds together. A lot of it's on government websites, so thank you very much. The First Lady has been pushing extremely hard around this obesity issue, and there's there's a fair amount of funding around both prevention and others. I know NIEH, National Institute of Environmental Health Sciences, has got some RFPs out for people to put proposals forward. What they all require is a linking between the design professional and the health professionals. One of the gaps we're finding is folks that actually know how to manipulate the GIS and other kinds of data effectively in both arenas. It's not real hard, but we just haven't trained enough people to cross over between the two worlds. Thank you.